and also doctors that might be at home at the time, then your network is very, very complex now, because each hospital will have their own policies in terms of security. How do you actually connect different organizations with non-standard security policies and still have a reliable connection? You don't want to start a video call. Oops, I don't connect because the IT guy at the hospital changed the policies of the firewall in that specific hospital. So one of the key aspects of deploying this kind of a solution is being able to overcome all the different topologies, all the different policies that might be imposed by the different participants, taking into consideration that these are not going to be uniform policies. Another example from another deployment in the national health system in the UK. In this case, this is a speech and language therapy service provided from North Bristol Trust Hospital to patients in a radius of 200 miles from the hospital. The therapist is in the hospital. Patient may be at home or at a local NHS facility. What's happening is you have to traverse between the hospital network. You have to go to the home of the patient. That may be a public network. Or you may need to go to a local NHS facility where the patient might be in a local facility over there. And for people from here who are familiar with an NHS network, it's all blocked. It's closed. So how do you actually traverse between the public network and the therapist who sits within the network if they don't open anything? So you need to have solutions that will allow you to actually go between, in a hybrid setup, go between the secure network and the public network in order to enable this kind of services. A few words about the perspective of the physician. I think the key word is streamline. This should be part of the workflow. I think the physician is very busy saving the lives of the patient. They don't want to think about solving the IT issues of why the video call doesn't connect, or where the cable is, or what is the IP address of the other unit. You would like to streamline it in a way that for the physician is a single click, that's equivalent for the patient opening the door going into the office. It has to be very easy to use. It needs to provide the remote physician with all the tools and control that you would have in a physical face-to-face interaction. And it needs to integrate other medical devices and data into the session. This is an example of such integration. And it looks very different from any kind of video conferencing user interface that you've seen before. This is implemented in Australia by Monash University and Alfred Hospital. And the user interface for this video conferencing system is a scheduling system. Basically, a physician, in this case, Professor Wilson, has on Tuesday, I can't read the actual date, somewhere in November, 4:45 p.m. is a consultation. He clicks on a button. Patient is brought into a virtual room. Physician has resources, might be the electronic medical record of that patient, might be a colleague that he can consult with for a second opinion. A call is over. Physical examination room is disappearing. The new 5 o'clock meeting is coming on, and that's all. So it's really streamlined into the appointment of the remote consultation. Another example, this is a medical community that involves 35 hospitals in Germany and Switzerland. In this case, the interface allows you to share medical information, to actually do searches of medical data, fully integrated with the video conference to allow for physicians to consult with their peers in other institutions, and also to provide with the resources. So I need to see someone at a certain ology to consult with. I can actually find the right person and then having share with him the pathology or any other kind of information, and then have a peer-to-peer consultation. And the last thing on the physician side is the control. We said that this should be accessible on any device. You still need to maintain from all the devices all the controls that you would need. You need to be able to control the remote camera, zoom in, zoom out, focus on the pupils of the patient, being able to change the video sources that are connected to, that you can actually have different views of what's going on with the remote patient. And again, repeating what I said before, all of that should be available as a software that you can actually access from any device, whether it's a Mac, PC, or any kind of software-based device. The patient perspective, it needs to be accessible at my home or at the local facility where I'm going. So it needs to work on cable or DSL modem. It needs to work on 3G or 4G. It needs to work on my hardware that I have at home already. It needs to be very easy to use. And it needs to integrate into the medical service that I'm getting. Here's an example. This is an integration that has been done by a Boston-based company called American Well. Business model is very interesting. It's a consumer medicine. Instead of setting an appointment, going to the doctor's office, you go in a portal, you are being federated to find the physician that can handle your complaint, and then you go into an online consultation with the physician. In between, you're also paying the copay for the consultation. All of that fully integrated in the backbone of that system. The user interface in this case, as you can see on the right, is basically a chat user interface with the physician that was assigned for you. And then a single click, and the physician and the patient at home are in a two-way video conference. Another example of what can be done to access this kind of services, in this case, it relates to the speech and language therapy example that I used before. Again, this is a package that was designed by the North Bristol Trust Hospital. It's basically a laptop in a ragged bag being home delivered with webcam and some audio device to patients. When the patients are done with the consultation, it's being shipped. Instead of the therapist being traveling, actually the suitcase is being shipped to the next patient. And that way, the therapist can do probably 10 times the number of consultations per day because they don't have to travel. Only the laptop is traveling from patient to patient. This is another interesting example from at-home care for elderly people that is deployed in Scandinavia by Eliza, the service provider over there. In this case, the problem was different. Elderly people may have issues with fine motoric. Some of them have never used computers. How do you make them actually go and interact over video in the simplest way possible? So in that case, the service provider completely customized the user interface to make it as simple as a phone call or a television remote control, and have people that have never used electronics before use a touchscreen pre-configured PC in order to call their caregiver or even call their families or friends with a very simplified user interface that basically has the faces of the users. So I think what I was trying to show is that there are a lot of considerations in order to actually scale, because when you scale, you will need to accommodate the target audience, what they are able or unable to do, and the delivery network, how you're going to deliver that. If you do that successfully, there are no limitations of what can be done with video consultation. And I wanted to just conclude my presentation with a short video of what can be done if you actually do things right. How do I get the audio to work? How do I get the audio? Sorry? Or it's
One of the nice things about video is its crystal clear quality, where the picture and the sound comes across like you're in the same.
You hear presence and personal presence and bandied about, but I think video has truly achieved it. When I talk with people that I have interacted with, they generally will have the same response, which is after a few seconds, I wasn't even aware that we were using any special technology.
One of the nice things about video is its crystal clear quality, where the picture and the sound comes across like you're in the same room.
It's real time. I mean, you are there. You so feel like you are looking the person right. You're looking them right in the eyes.
Video is a way to bring the doctors and the rest of the care team to the patient and their family in real time, almost immediately. No one has to leave work, no one has to leave home, no one has to leave their office. Spur-of-the-moment sort of conferences that can accomplish the same thing in 10 minutes that it might ordinarily take several hours.
As those of us who are experiencing video conferencing find that it's a more important part of our lives, we can't be restricted to only doing that when we're in a certain fixed physical setting. So the ability to interact with people by video from any type of laptop, netbook, mobile device, tablet, etc., is just as important as our ability to interact with the electronic medical record or to view scans.
It is very easy to configure, much easier than any of the others. The quality on a consistent basis is much higher than any of the others that I've used, certainly. And I think I've used just about any that's been out there.
There's very little manipulation or configuration on the end user's point of view. And then from a performance perspective, you don't need a whole lot of bandwidth in order to connect and have a high quality experience. In many cases, we've been able to install video on mobile cards and connect through a wireless Wi-Fi connection and still be able to transmit a high quality video and be productive in our virtual conferences.
So many of the types of databases and machinery don't talk to one another. That's the beauty of this. You're real-time sharing information and data. You can see the x-rays, you can see the images, you can see the reports if they zoom down on them. You can see everything as if someone is sitting right next to you and you have the document of the film in your fingers.
The clarity of the image would allow for a better assessment and diagnosis, or even change the treatment plan if that need be.
It ends up being a great time saver and a money saver for the patient, and a definite time saver for the professionals that are working in team together.
The fact that these tools are so easy to use and to leverage, and that they do really represent technologies that kind of move to the background and allow us to get our work done, means that we can begin thinking much more realistically about opening up access to care and specialty expertise to anyone, regardless of where they are in place or time.
Sorry that there was no sync between the audio and the video.